So I'm gonna begin. So pain-free sex to orgasm. We'll update. So there's a lot of fear and anxiety around having intercourse for many different reasons, but what could be causing you pain or just even fear of pain if you're postpartum and you haven't gone back to intercourse yet. It could be a very scary thing that first time. So we're gonna just talk about a lot of things to consider and tools to help manage that process. And then, above and beyond pain-free, talking about pleasurable experiences in sexuality. Our intentions for today, we're going to talk about defining sexuality and what your motivations are for yourself. And, a lot of the work that I do is getting people to really connect with, what their expectations and what their goals are, and where their concepts of sexuality have come from, and really figuring out what that means for them. Explaining dyspareunia, so painful intercourse, what the different, really defining what your symptoms are, because one person's painful intercourse experience can be very different than another's, and really teasing that information out to be able to come up with an effective treatment approach and protocol. And then, like I said, above and beyond pain-free sex, talking about libido, drive, arousal, pleasure, and orgasm. Because orgasm is kind of the grand finale, but there can be a lot more that along the way. Then enjoy the process. And even though there's, if orgasm isn't achieved, what can we do to be able to enjoy that process? And then just sharing and supporting with like-minded human beings like you guys. And a little bit about myself. I'm an occupational therapist. I graduated from Utica College 20 years ago, and I've been specializing in pelvic rehab for about 12 years now. I am not a sex therapist, so I just want to make sure that that's clear. I'm not a sexologist. So I'm not really working on in my treatment sessions, I'm not working on arousal or stimulation. I'm working on, and you'll see as we go, the physiological components of intercourse and intimacy and sexuality, as well as the psychosocial components, and trying to kind of reconnect you with your own sexuality. And all right, sexuality. So looking at your culture, your belief systems, society, your education, and religion, trying to figure out where are you in your definition of sexuality. Are you talking about alone or with somebody else? What is your gender and coupling dynamics? What's your definition of intercourse? Is it penetrative or non-penetrative? And combinations of such. So, non-penetrative massage, nice massage, light touch, fast strokes, vibration, compression, intimacy, or even just intimate gestures, can all be part of your sexuality and part of that sexual experience, or just intimate experience. Then penetrative, what are we looking at? Is it fingers? Is it a penis? Is it toys? Is it a vaginal trainer, dilator, or a vibrator? So taking everything into consideration. And then, senses. We've got multi-senses that can lead to arousal or security, to be able to get that autonomic nervous system into that nice equilibrium and balance, to be able to get out of this go, go, go in this wound up nervous system, but not too low key where you're just kind of turned down and turned off. You got to be kind of in that nice balance to be able to um, get into that aroused state. And then the physiological and psychosocial components, desire, you know, there's so many factors that go into desire and libido, psychosocial factors, hormone levels, anxiety, depression, fear, fatigue or depletion, medication, and chronic illnesses. And then again, what's your motivation? You know, drill down to your specific goals and what you're looking to achieve. All right, so first we'll talk about dyspareunia, so painful intercourse. It's important to figure out, you know, exactly what's going on, get specific with it. You know, is the pain before you have intercourse? Is it during? Is it after? Is it with orgasm? Is it with arousal? Is it upon entry? Or is it more with deep thrusting or a combination? Does it hurt in the beginning and then dissipate, or does it kind of build and stop you? Or does it, sometimes it can hurt and be so painful, and we can start getting anxious about it, and then our muscles tense up, and then it makes it physically impossible for penetration. Does it hurt if it's internal, if it's penetrative? Does it hurt if that's placed and held, or does it subside if it's placed and held? And then different positions. Does it hurt more if you're in a certain position or angle? And trying to work around that. And where is it? You know, is it external? Is it internal? Is it more superficial, or is it deeper? Is it more on the left or right? Does it feel like it's the genitals that are hurting, or is it more abdomen, hip, low back, tailbone? You know, just teasing out specifics. And that could be a process. You know, you might not know. You know it hurts, but to really get, you know, look inward and start to assess these things, can be like, oh, I'm not sure. I haven't thought about it. So, you know, that's a big piece of it as well. And then describing the pain. Is it a burning sensation? Is it pinching? Is it sharp? Does it feel like tearing? Is it like a dull ache? Does it feel like a toothache? Is it a radiating pain? Does it shoot to other areas? And all that can really help get specific about what might be going on. Is it a muscular? Is it a connective tissue? Is it a hydration and tissue issue? Does it seem more like nerve? You know, there could be things coming from the low back with nerves coming down to different areas of the genitals. So getting really specific to get to the root cause of what's going on. And there are a lot of different diagnoses. I didn't bother putting them here, but, you know, vulvodynia, vaginismus, you know, anything post-surgical, postpartum, or even prenatal as well, and peri and post menopause, cancer, prostatectomy, a lot of different factors that people could be seeing this in, or just no specific diagnosis, but there could be some other considerations causing some restrictions that could be causing pain. And then, so potential causes, oh, I guess I just did that. So musculoskeletal imbalances. So whether it's the pelvic floor muscles, here's our pelvis sitting upright. Okay, and then if I look at the underneath, these are your pelvic floor muscles. Okay, they cap that bottom, that big open space at the bottom of the pelvis. So, you know, looking at the pelvic floor muscles and what their coordination and integrity is, but also looking at, we've got a lot of like hip muscles and rotators that come around through here and that come right up inside the pelvis as well. And then you can also see the attachment of the pelvic floor muscles up to the tailbone and then the sacrum, okay? So there could be some SI joints, some low back, just all other structural imbalances that could be causing disruption to this area, okay, as well as abdominal. So, you know, embryologically, our abdominal fascial tissues are connected deeply with our genital and our pelvic, endopelvic connective system. So if we're having restrictions even up at the diaphragm or even higher up, that could all be pulling on the tissues and the structures in this area. Vaginal dryness, so looking at nutrition, hydration, hormone levels. Just move this guy here. Breastfeeding is very important to be considering for vaginal hydration. As you're feeding your baby, that baby is consuming your hydration and your moisture. So it will directly be affecting your vaginal tissues. Erections, so the pelvic floor muscles help with the coordination of the blood flow and erections. Postnatal considerations, just if there was any tearing, if there was any stretching, if there was any tightness in response to the trauma that has occurred, and that could be vaginal delivery or C-section. The breastfeeding, I spoke about hormonal fluctuations and changes, relaxin that's still through the body if you're breastfeeding. So menopause, peri and post. Again, it's, like childbirth is a major change to the body. And menopause is another major change and shift in the body. So, looking at, those hormones can cause a lot of different changes to be able to negotiate and just, troubleshoot through all the different options that you have. Overactive pelvic floor muscles. And this can come from many different reasons. So your pelvic floor muscles respond to stress, anxiety, fear, trauma, by tightening subconsciously. So it's more of an autonomic response. The message that the brain is sending to the connective tissue and the muscles to be able to protect your body, and being able to so those are factors, but it could also just be overactive from exercise, high intensity workouts, potentially maybe not having the best biomechanics and breathing strategies and postural strategies can lead to overactive pelvic floor muscles and connective tissue. Pelvic organ shifts. So if there's, look at our pelvic organs, I'm setting up some of them. We have our uterus, if you have one, rectum, and bladder. I'm missing the top right now. But these three structures are lined up in the middle of our body, right above the pelvic floor. So they're what's held up in this pelvic bowl, okay? And they're held up, they're supported by the pelvic floor muscles, but they're not directly held up by the pelvic floor muscles. They are directly held up by connective tissue attached to the inside of the pelvis. So this connective tissue can get disrupted for many different reasons. One could be childbirth. One could be just constant straining, so constipation. If you're constantly if you're constantly applying a downward force on the contents of the pelvis and those connective tissues, those connective tissues could get stretched out and loosened. And then these could shift down into the vaginal canal. Those pelvic organ shifts could be interfering with your intercourse. Different positions could, that you were okay with before may be really uncomfortable now. And considering, like, where's my uterus or where's my bladder position now, can be helpful to come up troubleshoot with some other strategies. Excuse me. And orthopedic considerations. If you have hip problems or low back problems, or you've got a hip replacement, they're going right through that pelvis, right through. So here's where the ball of the hip comes into. And you have all these muscles through here. So you're coming right into this integral part of sexuality. When you have a hip replacement or any sort of orthopedic, labral tears can have overlap with pelvic pain, GI distress. So if you have, there's many GI diagnosis out there, and like autonomic diagnosis that are involving our digestive tract. And if you're having like gas and bloating or loose stools or constipation, all that can be disruptive, to the connective tissue between the abdominal canister and the pelvic bowl. But also these pelvic floor muscles, they're trying to hold back all these things that are happening. They're trying to maintain continence, and they could be getting overworked, and getting tight or imbalanced. And then nervous system regulation imbalances. So, are you having a hard time getting out of that fight or flight state and getting into that rest and digest state, and coming up with ways to be able to self-regulate?